Hi, everybody. This is Alicia Leszewski, and I'm here with Ken Epstein for another episode of CX on Point. Hi, Ken. How are you?
Alicia, I'm doing great. I am very excited about today's CX On Point episode. I think it's going to be just fascinating, and I'm so happy to have Troy with us today.
I am too. I'm very excited as well. So with us today, we've got Troy Belden, who is the COO and the CTO of CareTalk Health. Troy has a ton of experience. I believe it's like over 30 years, but he started when he was like 5 in the contact center industry. But over a dozen of those years in healthcare, which is a topic that we do like to talk about. But I'm very interested in this. I've done a bit of work with you, Troy, and I'm fascinated by the CareTalk Health brand. So we're really excited to have you here with Ken and I. Welcome.
Thank you. It's great to be with you and Ken. Looking forward to this conversation as Ken as well. We've had a number of discussions, and it's going to be great to explore these topics.
Awesome. So we obviously, we are all contact center people, but CareTalk Health is really a breath of fresh air for outsourcing. So I think before we kind of get into our conversation today, you want to give our audience a little bit of an overview about what CareTalk Health does.
Absolutely. We started as a medical practice. We're licensed and credentialed across all 50 states plus DC. And we've formed kind of what we term as the first clinical process outsourcing organization kind of in the world or in the industry. And what we do is we take clinicians, anything from a CNA through an MD, so all levels of the clinical ladder, and we look to help organizations serve their customers, members, or patients in a better way through our clinical services.
I've worked very closely with Troy and team. And as the United States, as the world actually became more and more comfortable with virtual work, with working from home, and for all of us that have been involved with contact centers, we know what happened during the pandemic. All of a sudden, everybody had to figure out how to make their environments virtual because people still needed to be serviced even if they couldn't leave the house. And we began to see a greater acceptance for virtual work in general. We saw more and more companies opening up to the idea of having their workforce work virtually, probably lots of them because they had to, but they did. And now there's a great acceptance. So during COVID, I remember just the influx of telemedicine. It was everywhere. And it's not that it was something new, it'd been around forever, but now there was a real need. And that opened it opened the door for companies to really to finally tune their service offerings from a virtual environment in healthcare. And what Troy and the team from CareTalk have done is they've actually taken it to the next level, because it's not your typical telehealth environment. While they have doctors and nurses and all kinds of licensed clinical folks in all 50 states of the US, they certainly could write you a prescription if you've got the flu. What they're doing along the lines of monitoring patients, particularly in the Medicare environment, is something that has been sorely missing, in my opinion, as a remote workforce opportunity. And so, Troy, you want to maybe talk a little bit about how you guys transitioned through the pandemic and really took a strong foothold on this?
Yeah. Great. Thank you, Ken. And you do know us well. One of the things that we were able to accomplish over the last dozen or so years, there have been other clinical roles that have been able to go virtual. Think nursing with nurse advice, nurse triage lines, and other types of services that were performed by clinical individuals, those with clinical skills. Kind of the last cog in that was the physician. And so what we've been able to do, capitalizing on the increase in bandwidth and the services and the ability to deliver, both voice and video to all areas of the country, specifically focusing on medical deserts. And a medical desert could occur in Detroit, Michigan, as well as, the middle of Wyoming. It has nothing to do with, kind of being in a city atmosphere or a rural atmosphere. It's more of how far are you away from a medical provider? And so that's the real definition of a medical desert. So what we've been able to do is work with physicians, and we bring them into our practice, we credential them, we verify licensure, and then we set them up with a almost think a gig economy like schedule so that they can set their hours, set their schedule, and we present them with appointments. And those appointments are low acuity in nature. They are wellness visits, well care visits. They are not urgent care or emergency visits. For us to allow individuals to get services that they either can't get because of where they live, or they don't want to travel into a clinic. Through the pandemic, there was a lot of fear and intrepidation of folks actually going to an emergency room or a clinic because that's where all the sick people were, right? And so what they've effectively done is either didn't get the care that they needed. And it was interesting. One of the stats we found was in 2022, only 21.9% of all eligible Medicare recipients had an annual wellness visit, of which they're entitled to, and they should be getting for their well-being, because it sets the stage for additional clinical services and medical care that they may need that they just were ignoring. And so what we're trying to do is actually increase that by allowing folks, again, and partnering with organizations who have large quantities of customers, patients, or members. Think of a healthcare plan that has low annual wellness visit visit participation through the year. We're aiming to try to improve that and increase that. Or it could be a pharmacy who wants to extend services to some of their customers. Well, they could advertise with us. We would help them through this process and provide annual wellness visits, telephonically, virtually with their customers. All of those services start to play into these, medical deserts that exist throughout the country, and we're able to deliver that at size and scale of a large, previously known BPO, but we're a clinical process outsourcer. So what we've done is we've just taken the same technology and techniques that have been used to expand services in other verticals and industries like telecommunications, cable co, everything else, and we're able now to perform those same types of services in a very controlled clinical environment. That's really what we've built, and then we supplement that and support that with nurses, nurse practitioners. Our clinical team is phenomenal from that perspective, and then we've layered on top of that these amazing operational team members who have depth of experience in the CX or the customer engagement contact center, however you want to define it, that arena. So now we've taken a very specific set of skills and abilities in these clinicians and layered automation, technology, process to allow that to flow in a very controlled environment that provides amazing services to our patients.
What's so interesting, Ken, is that we were talking on a recent podcast just about the social impact that this industry has. And it's just with this whole medical desert thing. I mean, it's just amazing. Now this brings impact into a whole new light, right? With these, and I know that, some of these underserved communities or rural communities are truly benefiting from CareTalk's ability to provide these services, that there's no other way, right?
That's right.
Sure.
That's right. And what we do is we, from a communication standpoint, we offer voice only, so telephonic only, voice and video. So regardless of where they're at. Now, the infrastructure within the US has been improved through the pandemic and the need to do that to provide virtual services. But we still do things sort of what I would call the old-fashioned way, which is voice only. And we can provide those services that somebody may be ignoring or not getting. And not only are we thinking about this from the standpoint of a wellness visit, but there's ongoing care services that we provide. When we complete one of our intake visits or initial visits or annual wellness visits, as we like to refer to them, we look for other opportunities to serve them. Many of these individuals have chronic conditions. It could be one or more chronic condition that is incurable. It could be severe diabetes, it could be hypertension, hyperlipidemia, those things that we all live with. And once you've been sort of diagnosed with one of those conditions, it's important that you manage that. So what we've done is we've placed clinicians who do chronic care management services and remote patient monitoring, remote therapeutic monitoring, using amazing kind of products and techniques to engage with these members and these patients of ours in helping them manage these conditions in a much more effective way. So think of it from this perspective. If somebody has, CKD, chronic kidney disease, and hypertension, right? We may be monitoring what medications they're taking, and as they're taking their medications each day, we may give them a virtual high five, which just helps reinforce that behavior that they're doing something right, and somebody is at least acknowledging and encouraging them. Or they might be a little bit out of adherence on their medications or their steps or their diet or some of those things that we may see through our monitoring efforts. And we're going to give them a gentle redirection nudge so that, and we can do that through a voice exchange or interaction. We can do that from an SMS exchange, an email exchange, or our portal where we're flashing to them, hey, great job, or hey, let's focus on getting a few more steps in a very constructive way, so that they're not feeling like somebody's watching over every move they make, but we're also looking to try to encourage them and get them back on the right track, so that blood glucose levels are falling in line where we want them, or whatever it is, and then we cycle them through additional assessments. Here's the big thing that we do that we don't really talk about, but is one of these massive benefits. A lot of these folks living in a medical desert might be rural in nature. And many of these individuals are 65 or older, what I kind of call the forgotten generation. We have an individual now that is on the other end of a phone call, a telehealth visit, a virtual visit, that's going to talk to and engage with that individual. In some cases, that might be the only kind of exchange or interaction that they have in a week, might be one of our clinicians. And so our clinicians are there to listen to them, to find out what's going on in their life, talk about family members, grandchildren, successes, wins, concerns, all of those things. We have somebody there now that is engaged, and not only looking at it just from a medical perspective, but you also think about some of the light behavior. I call it behavioral health light, right? So a lot of these folks are lonely, and so they'll call us and they'll talk to our clinician. And that, again, that may be the only interaction or exchange that they have within a set period of time. And that's a service that's just invaluable.
You couldn't be more right about that. And Alicia and I have worked together for like 30 years, and we have worked with so many providers of Medicare services and dealt with Medicare members over the years. And it can be really heartbreaking to do that, because to your point, I mean, I remember walking through, and I'm going to tell the story, one of our contact centers with one of our clients. It was from a big Medicare risk taker payer. And we had an agent that was clearly on a call, but had her headset draped around her neck. She wasn't listening, and tears are coming down her eyes. And we looked at each other and we were like, is everything okay? Whispered to her, no, I'm fine. The client said, do you want me to take the call? No, I got this. She finished the conversation with the caller, who was a member. And it was like, well, what happened? And she said, the member called. He just wanted to know if a particular formulary was covered under the plan. I looked it up, and I saw that it was covered, and he was really happy with that. And then our CRM tool popped some information, and I noticed that it was going to be his birthday on Friday. And I just said, Mr. Smith, I just really want to wish you a happy birthday. To which there was silence and then sobbing on the other side of the phone. And the member said, I apologize. He said, my wife passed away 4 years ago. I don't have any family. And this is the first time in 4 years that a human being has wished me a happy birthday. To which everybody starts crying. Yeah. I was all choked up. Even the client was all choked up. Right. And it made me realize, and as I listened to calls over and over with this population, there are a lot of lonely people that don't have any connectivity. So we've always told anybody that interacts with them, make them smile. If they want to tell you a story about the time they went to Disney World in 1972 with their grandkids, that's great, because you're making them feel good. And that's a really, really, that's great medicine in itself, just making people feel a sense of worth. People think it's easy to do like member services work for this group. It's not easy. You have to have I couldn't do it because I'm a very emotional person, and I don't think I could last an entire day with trying to help somebody get a prosthetic leg that can't, it's just, I've heard so many horror stories. But I tip my hat to you for that notion, because it is so, so important. But can you talk a little bit, we've talked about this in the past, but some of the biometric tools, how are you monitoring? How do you know that somebody's, got a sugar issue, or that, they're not doing enough steps? I think that's integral to the success of this, and it's fascinating how you do it.
Yeah, great question. So one of our very first calls, we had a gentleman that called in. I think he was from Nevada. That's about all the information I can give you on where and who he is. But a very similar story to what you just told. In the last 6 months, he had lost his wife, and his children were far away from him, and he just wasn't talking to anybody. Very depressed, very lonely. And one of our clinicians struck up with him and started talking. And all of a sudden, you can just, and I listened to the recordings of the calls, his demeanor just totally changed, right?
Yeah.
Because he went from very sad, depressed, tears to, joyous, when she said, "You can call me whenever you need to." That's the key, right?
Yeah.
And so I think that's an intangible benefit of the services that we provide. But the biometrics are really incredible. We do remote patient monitoring, remote therapeutic monitoring using devices that, again, through kind of the infrastructure that's been built up in the country, either through 4G or Wi-Fi, however they can connect to us, we get readings, and we start to understand usage patterns, meaning, did you step on the scale today or not? And we can nudge them to do that, so we get the reading. All the way to, was your medication actually dispensed? We work with providers of all sorts of types: glucometers, blood pressure cuffs, pulse oximeters, flow meters. So somebody's going to blow through a tube, and it registers kind of their lung capacity. And we start to see that. And we work with them to set up a plan to make sure that, A, they're doing those measurements on the right frequency and the right number of times, so that we get those readings and we can kind of track their progress and their management of their chronic condition. That's really the key. In addition to that, they get the emotional exchange with us and the verbal exchange with us by talking with one of our clinicians. And we take the time to explain to them, here's why we're doing what we're doing. Here are the readings that we get. And we start to accumulate that data to see patterns and trends. Now, I will also tell you that we don't start with a device. For us, it's all about the human interaction and the human connection, right? So we start with chronic care management, where we get a clinician to connect, both from a interaction perspective and an emotional perspective with that patient. Our clinicians have done an amazing job detailing for, you would think for a condition like chronic heart failure, we might give somebody a blood pressure cuff, as an example, right? However, the first and really the only device we give them is a scale. Now, why a scale? Well, because one of the first indications that you're struggling, that your heart is struggling, is you're going to retain water. Your weight gain, you're going to gain 3 or 4 or 5 pounds in a very short period of time. So when our patients actually use the device, we get that. Our team is alerted to that. Again, it's typically not an emergency situation, but we will then outreach to the patient and say, how are you feeling? Because we noticed that you gained 3 pounds, like from yesterday. It's that real time, and it's that immediate. And so we start asking things like, do you feel shortness of breath? Are you feeling any of these typical symptoms that may be a result of kind of something going on with their chronic condition or some other condition that may have set in? And at that point, we'll make recommendations that they go see their primary care physician. We may even call 911. We have a database that allows us to bypass, because if I'm sitting in Wyoming and I need to call 911 where, Ken, you are in Florida, well, I can't just dial 911 on my phone. So we have a database that we actually tap into that gives us essentially the 10-digit kind of back channel number is what we used to call it back in the day, right? To get into a 911 that's in Florida in the city and zip code that you live, so that we get 911 or emergency services to you real time. And we'll stay on the phone with you until they arrive. So that's kind of the fail safe or the safety protocol that we put in place once we get you through that process. But getting them connected to us with a device, we do it several ways. If they've got Wi-Fi in their home, that's the easiest and the simplest. They just connect the device to their network and we're off to the races. And then we just work with them to make sure that they're using the device. Otherwise, we can send them a cellular hub, and that cellular hub plugs in the wall, and just through the 4G or 5G network, they can send it. It connects to the device, and we get the readings, and then we're monitoring that on a daily basis. So we've got team members who are clinical of nature, right, that are looking at that and then taking actions based on what's coming through the device and the readings.
You talked about there's the emotional and the emotional touch in addition to the physical, and to know that the monitoring, it's like somebody's with me all the time. It's somebody who's living alone and that's dealing with chronic illness, or even if they're not living alone for that matter, has that peace of mind. And I think that goes a long way to help people be happier, healthier, feel better. I'm not alone. Something goes wrong, I've got somebody that's gonna reach out and gonna help me right away. The idea of these medical deserts is it's relatively new to me. I've never really thought about it a lot, and the social impact that that you guys are driving and reaching. I mean, and I've become relatively aware of it recently. My daughter is a clinician, and she works in the Bay Area, Alameda County, and she is working with the most underserviced group of people that you would ever meet. And I just had I had no idea that there were so many people that just didn't get service and couldn't get service, and it wasn't there. So from a social perspective, you know, it really touches all the good things all the way across the board.
So I was just speaking to a buddy of mine who lives in a pretty rural part of the country, and he's now working with a doctor who is bringing these weight loss injections into an area of the country that had not seen them. Really, it was harder to get than perhaps where Ken and I live in South Florida or some of these bigger states. So right. I'm curious with all of the, and I don't know what the right term is it lifestyle or wellness, but it just feels like your clinicians could really make an impact for those types of companies, which are popping up left and right. Is that something, are you guys working probably with those types of companies, right?
We are, and that's a great question. There are, and you're right, Alicia, that some people call them lifestyle medications. I like to call them wellness medications, versus kind of a condition-based medication, right? And it's been interesting because one of our clinical leaders, she leads our entire nursing team, said to me yesterday, in fact, Troy, could you imagine if these GLP-1s or semaglutide medications, and they will be refined and they will improve over time, if that removed a large percentage of obesity out of the country? And I hadn't thought about it that way, right? What that would do for chronic conditions, for the health and the well-being of the country, just because there are so many obesity-related comorbidities that show up, right? So that's my kind of philosophical view of this. Yeah, we can work with organizations who again have patients, customers, or members, serve them in a clinical capacity. Now, many of these weight loss medications, the semaglutides, there are other medications that we look at, hair loss, erectile dysfunction. There are things that are out there that are helping individuals live a much more fulfilled life than what they might be doing already, and extending wellness. We have the ability to perform those visits with our clinicians, because one of the things that we are, in addition to a medical practice and a telehealth company, we're a logistics company. So in our past lives over the years, if we were doing straight customer service, we could have a team member, in Idaho answer the phone, and it didn't matter where the customer was, you could serve them. Right now, one of the things that we do through some of our, I call it a scheduling engine, is we match up the patient and where they're at. We go look at all of our providers, find a licensed provider in that state that patient may reside, look at availability and desired appointment time for both of them, match all of that up. So that's kind of from the technology side of it, what we do. We can do that through various channels within our platform, and then we can extend that to if somebody has, they want to do the scheduling within their platform, we have APIs that they can actually request availability from us for doctors, and we'll supply that to them, and they can do the scheduling in their platform. So there's lots of flexibility and ways that we can do that. Most of these wellness visits anymore are what we call asynchronous, meaning you're going to fill out a form and answer a bunch of questions and submit that, and a physician will be back to you typically in 12 to 24 hours. That's kind of where the industry is at the moment. What we're trying to do is fulfill and complete those visits in a shorter time window. Because these are optional, lifestyle or wellness types of medications, there's a little bit of a close rate sale you've got to think about, that the medical industry in the past has never really had to worry about. And so we want to get those visits done even faster so that, the medications can be delivered sooner and individuals can start benefiting from that even earlier in the process. And so we do those asynchronously, meaning that we don't have to see you face to face or have a voice exchange. And then we do a lot of what we call synchronous visits, which are wellness types of visits. You could think genetic testing. There's a lot of that's taking shape. And Ken, to answer your question, in addition to Alicia's, where I see this going is the telehealth industry is going to do nothing but grow. People are seeing this as a convenience to go see the doctor without having to walk into a building. Providers and clinicians are seeing this as an option where I can now work, either supplement my current clinical income, on the side, or I can do this as a full-time engagement. And now I don't have to walk into a hospital or a clinic anymore. And I can serve humanity the way in which I wanted to when I went to school, in med school, in a very different way, in my fuzzy slippers, or, like we used to say in the old days, right? However you wanted to do that. And so I see us starting to look at this from a kind of traditional medical platform. We're going to be doing annual wellness, urgent care types of visits, chronic care management, remote patient monitoring, all of those pieces, as well as adding in these wellness or lifestyle medications, because either way, we're starting to see how we can benefit humanity, so to speak, in different ways. We were having a conversation with our medical director not long ago about a specific application, and I was a little iffy on it. It's kind of cutting edge, and I was like, and I thought he would be the one to say, "Nah, I don't want to take that risk." But I was the one saying we shouldn't, and he came at it from a very different perspective, which I think is interesting. He said, playing a little bit of devil's advocate here, Troy, what if we put enough safeguards in place that we were helping people by using this cutting edge treatment? And I'm like, I didn't really know what to say, right? I'm kind of dumbfounded, because he's saying it that way, where I was thinking about the risk, he's thinking about the benefit. And I said, agreed. He said, just think, this is early on. Who else could benefit from this? And are we depriving somebody of this possible therapeutic treatment plan because we're not willing to take the risk now, because it's a newer type of therapeutic? And I said, that's great. We ended up passing on it for now. And we'll continue to kind of reassess and look at it again. But that just kind of opened my eyes to how many more people can we help in different ways with things that we don't even know about yet, that are in a formulary lab somewhere. Peptides is a big thing, right? And GLP-1s are a type of peptide. but I think there will be different type of peptides that are going to emerge on the market that would be beneficial. And as soon as they're ready for prime time, we're going to be there ready with our processes, our support, our medical practice, all of the quality of care and the continuum of care that we like to provide to support those applications.
You know, it was very interesting what you said about the weight loss medications, because I think most people look at it, and unless you're morbidly obese, you go, oh, it's just people want it's the vanity. It's all about looking good. And I don't think people really stop and think about the comorbidities associated with being obese, and that it's not all about I want to look really good in my skirt or my suit, and it's really about health. It's about living longer. It's about maintaining better health. So I don't think, and you watch, if you watch TV anywhere, you get bombarded with all of these different medications. And I would think that there's a huge market for you guys from the standpoint of all of those different pharma solutions that are coming out. And, you know, they put an 800 number up because you have to at the end, but
Yep.
Maybe rather than have to go see your doctor and schedule a visit just to talk to them about a hair loss or an ED or a weight loss thing that you saw on see on TV, real quick, work with you guys. You guys can write the prescription once you take them through an evaluation. I think that there's just a great market for you in that, and I think there's a big need. It's just very, very interesting as this thing goes. I also think that, and we talk about these, you know, medical deserts. We talk about going into a healthcare practice, getting in your car. I think that you could actually become PCP for a lot of patients out there who don't really have one. You got, it's very different than a typical, like, you know, telehealth where I call because I've got the sniffles and I need somebody. You can actually take somebody on as a patient. And I know one of the things we've talked about is certainly working with payers who have to do health risk assessments at the beginning of the year. They need that annual wellness visit. They're required by CMS. It's a HEDIS issue. They have to check that box. You guys can actually do a health risk assessment and dovetail right into the annual wellness visit. Same thing, think about gaps in care and all of the gaps that are out there. There's a lot of, and particularly as biometrics are becoming so prevalent and so, you know, cutting edge. I mean, I even think that there's a great opportunity to fill gaps in care virtually using the clinical, you know, the clinical outsourcing practice.
Yeah, I think you're right, Ken. One of the things that, you know, over the last 5 or 6 years prior to joining CareTalk Health, I ran an organization that did non-clinical outbound calling, so engagement work outbound, to call members of large healthcare plans to try to close gaps. And I always thought that there was a slight flaw in not how we were doing it, but the overall process of it. So what I would do is I would have one of my team members would call Ken as an example and say, hey, Ken, it's time, you know, we need to set up an eye appointment. We'll make it kind of benign, right? Just an easy eye appointment. Let me call your eye doctor with you on the phone and we'll schedule a time that works for both of you. Well, that's great. That's you're getting kind of halfway home, right? But
that's the typical way everybody's been doing it.
Exactly. But now what we can do, not necessarily for an eye exam, but for other HEDIS measures and gaps in care, we could say, hey, I've got Dr. Alicia, she'll be our doctor for now, on the phone, ready to see you. Let's close that gap right now. One call, one stop, you know, first call resolution in its, you know, in its entirety right there. Now, Dr. Alicia could do a number of things saying, okay, if we've got a HbA1c we've got to do, I'm going to write an order for you to go to the Quest lab that's a block and a half from your house, because, or LabCorp, whoever that, you know, laboratory is, to actually go in and have a blood draw. And now that will come back to us, and then we'll completely close the gap and let you know what your HbA1c is. Or think Cologuard. We can prescribe Cologuard for, you know, for the replacement of the colonoscopy. And there are other measures that we can actually close with a one-stop real-time solution. In addition to that, you know, we can do the nurse advice, we can do the triage up front to have a real kind of, at one point in time, we all called this kind of ER diversion, right? Because going to the ER is incredibly expensive for healthcare plans and for individuals. I don't really think about it that way. I think about it differently, and I want to get you to the best site of care. So if you call one of our nurses, we may start with a nurse, and the nurse is going to kind of understand what's going on, what symptoms you're presenting us with, make some determinations whether you need to talk with one of our physicians, or yes, we need to get you to the ER. And those are some of the solutions that we can help healthcare payers and actually, facilities, providers with that service that allows them to help manage their population in a much more efficient, much more effective manner than what they've ever done before. It allows for that best site of care, right treatment at the right time, at the right place. And I think as we continue to see this evolve, healthcare at home is just going to explode. We think that we've seen something now. 3 years from now, it's going to be even deeper. There's going to be more options, more technology, more biometric devices, and more care that can be delivered, and somebody doesn't even have to leave their house.
One of the companies we work very closely with actually has the emergency room on wheels. So they will come to your house. You guys realize there's a problem. You contact them. They
Right.
send a medical truck out that can do, I think, maybe just short of surgery that they can do when they get to your house. You never heard of that. And it's almost ironic because think about, 50 years ago, the doctor used to do house visits, right? And we kind of got away from it, and now we're back in the home. I love what you guys are doing. I think you are absolutely pioneers on the cutting edge of this opportunity, sort of pulling together technology, contact center, and healthcare all under one roof, with so many different applications for it. I mean, we talk all the time. It's everything from the pharma products and that we discussed, maybe for for ED or for blood pressure or for whatever else that they're selling, or hair loss, to the very hardcore chronic management of somebody who's got a life-threatening disease, and they know that they're not alone with you guys.
Right.
It's just I admire what you're doing in so many ways.
I appreciate that. It's a labor of love, right? Because again, there's so many people. When I think about 70% of people who should have gotten a visit didn't, and it's like, why? We're better than that, and we're just trying to find a way to meet patients where they're at, to deliver the services they need, again, at the right place, at the right time, with the right provider, and then and allow them a choice, afford them a choice to be able to select. I don't want to go to the clinic. I don't want to go to the ER. I want to do this from the comfort of my home, and be able to kind of get the treatment and care that I'm looking for and that I need. And that's what we're all about.
I appreciate the time today, Troy. I really do.
Appreciate it. Thank you guys for the time today.
That was great. Thank you so much. And I think that wraps up another episode of CX On Point. Thank you, Troy, for joining us. Thank you, Ken, as always. And we'll look forward and definitely welcome you back, Troy, whenever you have an update. Thanks again.
Awesome.